Hello world, this is Roberta. Roberta is a 60-something grandma who loves playing with her grandchildren and enjoys wine and paint nights with friends. Lately, Roberta has been experiencing persistent fatigue, loss of appetite, weight loss, night sweats, and pain in her abdomen. She also recently found a swollen lymph node, which has her worried. Roberta decided to consult with her primary care physician.
I'm sorry, Roberta, you have non-Hodgkin's lymphoma.
That was until Roberta's doctor told her about methotrexate. Methotrexate is a type of anti-cancer drug. There are 3 classes of anti-cancer drugs: cytotoxic agents, hormones, and biologic response modifiers. Methotrexate is a cytotoxic agent that is an anti-metabolite, meaning it acts to disrupt the metabolism of cancer cells. The mode of action for methotrexate is that it disrupts metabolic processes of DNA replication. It inhibits dihydrofolate reductase, which is an enzyme that is a necessary step in the activation of folic acid. This disruption in the production of folic acid stops cancer cells from creating essential parts of the cell and triggers cell death. Unfortunately, this mode of action works on all cells, not just cancer cells, so chemotherapy with this drug will require careful dosing intervals and lab work to ensure your body can handle methotrexate. This medication will suppress your immune system and damage your bone marrow, so we will need to monitor you for infections during your treatment. We may also use this medication in combination with another anti-cancer drug, the mitotic inhibitor vincristine, since vincristine is a bone marrow-sparing drug, meaning it can attack the cancer in a slightly different way without adding to the bone marrow-suppressing effect of methotrexate.
Other therapeutic uses for this drug include use to fight leukemia, osteogenic sarcoma, and even rheumatoid arthritis. This medication is typically administered orally by intramuscular injection or intravenous.
Side effects include bone marrow suppression resulting in decreased immune response and possible anemia, oral and GI ulcers and/or stomatitis, some nausea and vomiting, and when used in conjunction with vincristine, tissue damage may result from extravasation.
Please note, like most anti-cancer drugs, this drug is not proven to work well on cancerous masses or tumors, and a debulking procedure involving removal of some tumor tissue may be necessary before beginning chemotherapy. While receiving treatment, your nurse will need to monitor lab values to verify that you have a sufficiently high neutrophil and red blood cell count before administering each dose. If taking this medication via IV in combination with vincristine or other chemotherapy drugs, verify that the vein being utilized has good flow and is flushed easily. The nurse will need to continue monitoring for any sign that the drug is leaking from the vein into surrounding tissues, as this is a serious complication and can cause major tissue damage. Leucovorin rescue may be required and is commonly prescribed drug alongside methotrexate to help spare healthy cells of the body from the effects of high doses of methotrexate used during chemotherapy. The timing and dosage of leucovorin is critical to safe administration of this medication. After chemotherapy with methotrexate, Roberta is back to playing with her grandkids and enjoying her life.
Thanks for saving my life, Methotrexate.